I'm Dana Friedman. I'm president of the Early Years Institute, a regional organization promoting the importance of the early years. I worked as a lobbyist in Washington on early childhood issues, then worked with corporations trying to help them create on-site child care centers, and for the last 10 years have been working locally to try to improve early childhood investments at the community level. The mission of the Early Years Institute is to increase investments in the early years so all children are ready for school and succeed in both school and life. And when we began doing research, we were focused on improving early childhood services in the community. But after doing demographic analyses, we realized half the children on Long Island are not in the formal, regulated market of child care services, child care centers, Head Start programs, pre-K programs. They are in the care of family members, relatives, and neighbors. So how is it that you get to that half of the population to ensure their children are also ready for school? And we do that by going where they pay, where they play, and where they pray. And that brings us to libraries, to parks, to churches, and other religious institutions, and of course to pediatricians. So several years ago when we began the Early Years Institute, we had pediatricians among our chief partners. We also did our homework and learned that among parents, pediatricians are the most respected source of information. So with that, we interviewed a lot of pediatricians on Long Island, several hospitals and clinics to learn what they were currently doing to help families with the range of needs that they have and not just health needs per se. Pediatricians, because they see parents on a more regular basis, are the ones that can provide them information about where to find child care, where to get support to do screenings for developmental delays, where to get resources in the community that help them get their children ready for success in school and life. So we have begun implementing several initiatives around Long Island, working with several pediatricians to get information to their parents. And we are right now in the middle of a pediatric resident training program, working with 4 hospitals on Long Island to train all incoming residents in pediatrics about the importance of social emotional development, and particularly focusing on the role that parents can play by talking, reading, rhyming, singing to their babies early on in life. What inspires me very simply is children. They're the innocence of the world, and regardless of what you think their parents did to get them in the predicament or situations that they're in, they all deserve an opportunity to be successful. So we are focused on them. It is also really critical to remember that 85% of brain development occurs within the first 5 years of life. Intellect, social, emotional development is pretty much hardwired within the first 5 years, and yet we spend 95% of our education dollars on children over age 5. When we talk about educational reform, we have to remember that education begins before school. In fact, as every pediatrician knows, babies are born learning, and we just have to optimize those experiences to make sure they reach their potential. So all of the importance of those early years and how fragile their lives are, but nothing but fate lands them in the position they are. We and the Early Years Institute truly believe in helping all children be successful. I think the most important thing that a pediatrician can do is to create a welcoming environment for the people and families they see. We have witnessed too many practices which are not culturally competent and don't understand, that some of the patients may not understand the processes or the language that they're using, to be patient and resourceful in trying to figure out the best way to communicate with those families. It is really important that pediatricians think about non-traditional forms of marketing to go deep into the community and let parents know that there are resources that they have. And I think most importantly, to work with colleagues. I know there's competition among pediatricians, but if there were more uniformity in terms of what pediatricians did during their visits with their patients, we can be assured that parents aren't having all the trouble they're having enrolling their children in kindergarten or watching the registration process unfold across Long Island. And there are a lot of health records that families don't have that we think the pediatrician could be very helpful in acquiring. And I think finding out about policies that exist either at the county level or at the state level, being aware of what it is that is probably consuming the concerns of their patients. Child care, for instance, is a very important, critical need. Parents are to work, support their families, and help children get some good experiences. And yet most parents don't know where to go to find that care. These are just simple information. There's 2 county agencies that offer parents referral services, knowing about them, making sure that they have answers to the questions. They don't have to have the answers, but answers at least to send them to somebody else who might have the answers and serve as more hope for all. We are very engaged in individual communities as well as working across the region here on Long Island. And we do that because we want to help communities value children. And the tool that we're using is something called the Early Development Instrument, otherwise known as EDI. It is a tool that's mandated across Australia, Canada, Jamaica, Chile, it's gotten to Europe. And we've enabled Westbury, Long Island, to be one of 14 sites across the country that is testing this school readiness tool for the United States. It is a population-based measure, which means that kindergarten teachers fill out an online survey about each child in their class around the middle of kindergarten year. But the data do not come back by child or classroom. They come back by neighborhood. So we can geomap the data, which composite form a look at the whole child. So it is about health, mental health, social, emotional, cognitive, and language communications and general knowledge. These are the national school readiness domains that are used across the country, and this tool tests each of them, with health being a very major area of concern. We are working in Westbury and have plotted the data to show where in town the biggest needs are. One part of town, there are a lot of children with health vulnerabilities, and now we're investigating, is that because they don't have access to pediatricians? There isn't the language, the hours, the insurance, the transportation. What is it that's impeding these children from having the kind of health skills and resources and behaviors that we know they need? So we're investigating deep within communities how to address the various elements of the whole child and what will help them be successful in school. My leadership style when it comes to the community follows the model of ABCD, asset-based community development. And what it requires for somebody coming into a community from the outside is to lead by stepping back, is to work with the organizations that currently exist there, help educate them about needs, put them in touch with resources, but most importantly, understand their vision and their wishes for the children in their community, and bring in other members of the community with whom they can work to make that change. We are trying to create sustainable solutions, and another institution can't come in and do that for them. We have to help them build the capacity and work together to make that happen, and that's the hardest work that we do. And we have a leadership team in Westbury of some 40 organizations that have been working together for over 2 years, and pediatricians are very much a part of that.